I'm Dr. David Hill, and today we're going to talk about how to prevent migraine halos. Now, migraines are headaches, yes, but really they're a process that involves how signals are transmitted in the brain, and they can have a lot of manifestations other than pain. The most common non-pain manifestations of migraines are probably the visual manifestations. We call this part of the aura, which is all the stuff that has to do with a migraine that is not pain. Also, when it's the eyes, we call it scotomata. A scotoma is anything that you see associated with a migraine that's not really there. It may be a blob or a flash, it may be a cut in your visual field, it may be zigzaggy lines, outlines around things, even distortions of shape and distance and size that you get with the migraine. That's all because the visual processing portions of your brain are involved in the process that causes the migraine. Now, some people will see halo. They'll see this sort of outline of objects or people that they're looking at. They may have some visual field cuts around the outside, and treating that is sometimes a little different from treating migraine pain. Specifically, if you're taking a medication like Imitrex or Maxalt, one of the triptans that's used specifically for migraines, you should not use the medicine just for the visual aura. You really want to wait until the pain occurs. If you use this medication before you're starting to hurt, at least theoretically, there could be an issue with closing off some of the blood vessels that go to your brain. That's how these medications supposedly work. So be sure you wait until the first moment of pain before you take a migraine-specific medication in the triptan class. If you're having these symptoms more than once or twice a week, you probably want to talk to your doctor about a preventive medication, something you would take every day to keep the migraines from happening in the first place. Now, there are a few different flavors of these medications. There are beta blockers like propranolol. There are older antidepressant medications like amitriptyline, and there are anti-seizure medications like topiramate. Different patients respond to different medications, so it may take a little trial and error. It may also depend on what other disease processes you have. For example, if you have asthma, propranolol is probably not your best idea. It could make the asthma worse. So, talking about how to treat the halo with migraine, I'm Dr. David Hill.